That's with you guys. I don't know. You guys have already figured it out. Sorry. Good morning, everyone. I want to acknowledge, of course, we're on the traditional territory of the Lekwungen-speaking people, the Songhees and the Esquimalt First Nations. And today we're here to announce the beginning of our opening up of elective surgeries, the phase 2 of the BC Restart Plan. COVID-19 has changed so much of what we do and how we interact with each other. We've worked hard together to flatten the curve, and we've made great progress. Dr. Henry and Minister Dix have been advising us on that on a regular basis, but we can't lose sight of the importance of ensuring that if we're sick, we stay home. We want to make sure that the compromises that we've made to our interactions with other people are not lost. Those huge sacrifices, of course, have included, as of May 18th, 30,000 elective surgeries that have been canceled. That's 30,000 people who have been having to endure pain and other suffering as we've worked together to address COVID-19. But because of those sacrifices, we've been able to move forward. Yesterday's plan was a slow and safe restart, and it will include guidance from Dr. Henry and other public health officials as we bring in the important changes to how the province will operate within the economy and within our healthcare system. So as we resume elective surgeries, we're going to have to ensure that we have safety protocols in place for patients, safety protocols in place for surgical teams, and of course, as we start to discuss how we will bring these elective surgeries back online, it is an option for patients to wait until they're more comfortable to enter the healthcare system. But every precaution that can be taken has been taken. Right from the beginning of this pandemic, we've been focusing on ensuring that the public interest is front of mind and that the health of British Columbians is our preoccupation. As we enter this new normal, we're going to continue to be washing our hands, keeping a safe distance, and of course, staying at home if we're sick. Now is not the time to let down our guard. Now is not the time to forget the sacrifices that people have made. And instead, we should remind ourselves that 30,000 British Columbians have been suffering not just by not seeing their friends, not just by not going out to enjoy the splendor of British Columbia, but they've been living in pain. Today, we'll start the process of relieving that pain for people who have been suffering because of the lack of elective surgeries. I'll turn the microphone now over to Minister Dix, and he'll lay out how the plan will unfold from this point forward.
Thank you very much, Premier, and Dr. Henry and I will take you through the presentation. It's a shorter presentation than that we provide in the technical briefing, but all those presentations, including our surgical plan, will be available online. I'd also like to thank Michael Marchbank, who authored this plan along with many other people in the healthcare system. Mr. Marchbank is the former president of the Fraser Health Authority from 2014 through 2018 as an outstanding healthcare leader in our province, and we're very appreciative of the role that he played. On March 16th, 2020, we took the very difficult decision to postpone non-urgent scheduled surgeries. And you see this, and you see the effect of it. The Premier just spoke of the effect of this. And our commitment to you is this. There has been an enormous commitment by healthcare workers, by the healthcare system, by the Premier, by the government, to address the healthcare effects of COVID-19. Dr. Henry showed this in the presentation on Monday about the relative success we've had, especially compared to other people, in dealing with people who required the care of critical care and had COVID-19. It has been an extraordinary effort. It has been a 100% effort. And our commitment to you is that we're going to see the same kind of effort from the healthcare system, 100%, to address the backlog in surgeries caused by COVID-19 in the coming months and years. All patients needing surgery are at the center of this surgical renewal. We will do this in the safest way possible for patients and providers. We'll be 100% all in this effort, and everyone involved in the healthcare system is committed to this idea. The next slide talks a little bit about the pandemic impact on surgery, about the numbers. Our estimated number of lost cases, you'll see on the slide, is 30,000. 14,000 of those had their surgeries postponed because we scheduled them in 3-week increments. 16,000 who have been normally scheduled in this period on the wait list. So that number, as you can see on the right here, is 30,298. We've also
British Columbia, we recognized that we needed to take extraordinary measures to ensure that we could provide safe care, both for people who had COVID-19 in our healthcare system, but also for those who needed healthcare in other sectors. And part of that was the actions that we needed to take to ensure that our surgical teams and people who needed surgery during this unusual time were cared for as well. So there were new clinical protocols that were developed to manage patients during surgery. Part of those were making sure that people didn't have any symptoms, that they hadn't been in contact. But we also recognized that when we had COVID-19 circulating in our community, there would be people that may be carrying it. So we needed to treat every surgical patient as if they might have COVID-19, and that led to protections such as decreasing the number of people in a room when we're doing procedures like intubation, putting the breathing tube down into someone's throat, because we know those are situations that increase the risk of a transfer of the virus. These protocols were needed when we were having our increase in community spread here in BC, and they were based on evidence and discussed with the clinical expert reference group that we put together here in the province. They were informed by public health and by the epidemiology of what we were seeing in our community. We need to take a different approach to this. So we know, and we are working very hard in public health to identify every single person who has COVID-19 in our province, and that helps us understand where the transmission is occurring. And that means that we can safely resume surgeries, and we no longer have to assume that everybody has this. We can now safely assume that most patients do not have COVID-19. And that allows us to change the protocols and to make them no less safe, but certainly a little more streamlined. So to be able to enhance and increase our surgeries for those who need it here in BC, we've now put in place very extensive screening protocols for everybody who comes in for surgery. So when you get your call about your upcoming surgical date, you need to continue to self-isolate. Make sure you're not putting yourself at risk by being out in the community, by having contact with people that you have not had contact for in the next little while. It's going to be incredibly important that we all continue to take those measures, but particularly if you have surgery scheduled. And then we will be having a detailed screening protocol for everybody at that 24 to 72 hours when you get a pre-anesthetic consult. There'll be a screening protocol to make sure that you have not been in contact with anybody, that you don't have any symptoms, and we have a protocol in place that allows for rapid testing should anybody have symptoms and it be required. And then that process will be repeated on your day of surgery so that everybody is confident that we don't have people who are at risk or have risk factors for COVID-19. Obviously, if there's urgent surgery that's needed, those protocols will be sped up and put in place as well. So these clinical protocols and the infection prevention and control measures are what we need now to make sure that we can ramp up our surgeries and get people in for the procedures that they need and keep everybody safe. And it depends, of course, on the work that we continue to do in public health to make sure that we are testing everybody in our community that has symptoms of COVID-19 and that we're rapidly able to do the contact tracing and isolation that's needed to prevent outbreaks and more spread in our communities.
So the first step of this surgical plan will be to establish system readiness, which is the next slide. Patients will be called, are being called and will be called over the next 10 days to confirm they are willing and ready for surgery. We know some patients may be concerned with that, and we're going to engage with them and their primary care physicians on that question. To protect healthcare workers, of course, as Dr. Henry has talked about, new clinical protocols on managing patients through surgery are being implemented. The needed PPE, supplies, and drugs required for surgeries have been confirmed. This is a key part of our readiness, and I've been reporting regularly, especially on the issue of PPE. The beds required to care for surgical patients as well as COVID-19 patients have been confirmed. That's part of the planning, and that screening programs and pre- and post-operative care services are being operationalized. This is very important because in addition to surgeries lost, the fact that we've done considerably less screening, for example, FIT tests for colorectal cancer, for example, mammographies and so on, we've done less of those in these times, and we're going to have to catch up there as well. And in some cases, we will be discovering things that we would have discovered earlier. Our surgery renewal plan beginning this month is going to be a massive renewal. It is a hugely ambitious plan that will keep up with new demands for new surgeries and clear the backlog created by COVID-19 over the next 17 to 24 months. The plan has 5 key steps: increasing surgeries, increasing essential personnel, focusing on patients, adding more resources, and reporting monthly and in detail on progress. Next slide. The surgeries and essential personnel, we want to speak to that briefly. To increase surgery capacities, we will refine and update processes to minimize the 30% productivity loss I spoke of earlier, extend daily operating hours, including weekends, open new or unused operating rooms in the healthcare system, and contract with private surgical clinics that agree to follow the Canada Health Act. We will train and recruit the healthcare professionals we need to deliver and sustain renewal in the months and years to come. That includes in the area of anesthesia and surgeons, in other support staff, and nurses. We'll also, and on the next slide, talk about patients, resources, and reporting. We'll continue the local collaboration on prioritization of patients. In other words, that requires the clinical advice of experts in the system, of doctors in the system in particular. We'll focus on patients who are urgent, had surgeries postponed, or have been waiting more than twice their clinical benchmarks. We will maximize day surgeries such as cataracts, which are frequently done outside of the hospital. Like many programs and services impacted by COVID-19, the delivery of this plan also requires added financial support. We believe it'll be in the order of $250 million in the first year, and we are committing to making the required investment to support renewal. The Health Ministry and health authorities are committed to transparently updating British Columbians on the progress of this plan by health authority and by month, with regular reports on strategies as they are being implemented. So we just want to lay out what the targeted timelines are. May 7th to 15th, contacting all patients who had surgeries postponed. May 18th, starting non-urgent surgeries up again. May 31st, contracting private facilities to work at maximum capacity. In June, training, recruiting, and hiring more staff. June 15th, running all existing operating rooms at full capacity. So that is what we're looking for, a month where we will continue to lose ground, but start to do scheduled surgeries, and then hoping to get to full capacity by June 15th. And then from June to October, all surgical locations begin adding capacity by extending operating hours, adding weekends, and adding new operating rooms. As noted, and as Dr. Henry has suggested, all of this is dependent on avoiding resurgence of COVID-19, and our plans include plans to address that should it arise. So with that, I'd like to invite the Premier back to the podium to take questions.
Thanks, Adrian. Thanks, Bonnie. And I think, Jen, you're...
Yep. A reminder to reporters on the line, please press *1 to queue and unmute your phones. You won't be audible till we call your name. Our first question comes from Tanya Fletcher.
Hi there. I know in the technical briefing you broke down kind of the target goals for nurse recruitment. I'm wondering if you can talk about how many surgeons and anesthesiologists you'll be trying to track down, what the goal numbers are there, and how you and where you plan to find them.
Well, the plan with respect to nurse recruitment is approximately 400 nurses. It's our hope to hire all the graduating nurses this year and to significantly increase training so that nurses who are existing in the system can upgrade skills if that's required, and also to hire all of the staff required, which will include not only nurses and anesthesiologists and increasing our capacity there, but as you note, surgeons, but also medical office assistants that are required, cleaning staff that are required, people who are involved in, and very importantly, in device reprocessing. So it will require a significant investment across the system. As we spoke of in the technical briefing, that's approximately 400 nurses. Okay, next question.
Our next question comes from Vrishti Basu.
Hi, everyone. Thanks for doing this. I just want to circle back to patients being called starting today. Will this call be just to make sure they still want to go forward with the surgeries, or are they also going to be rebooked in at a specific date? What can people expect today?
Well, the first call is to touch base with them, to let them know that we're starting again, to see how they're doing and to engage with them on both their willingness to go forward with surgery. And then as we go forward, we're going to start booking surgeries. But we need to talk to the people who have seen their surgeries delayed to begin with, and that's what we're going to start to do today. That's a necessary step in restarting the system. See about both their willingness to go forward and to talk to them about that. There will be some people who are naturally reluctant. I think you'll note for our daily briefings that we've gone, right now we're at about 4,600 emergency room visits a day from the previous average of about 6,500. So people are reluctant at times to come to hospitals, so we have to prepare for that, and we have to talk to patients about that.
Our next question is from Mary Griffin.
Oh, hi. Thanks very much. This question came up in the briefing, and I just thought I'd ask again. With so many surgeries on the wait list, why not go with the 24-hour operation of the operating rooms to clear the backlog? And also, what also came up is it was quoted that it was easy to shut down the elective surgeries, but can you give us a sense of just how much of a gargantuan task this is to bring them back up?
Well, like everywhere else, I think COVID-19 is affecting hospitals like every workplace in BC, and so we're having to take steps to deal with what we call productivity losses, but the extra time we have to take to make sure that staff are safe and to make sure that patients are safe. So it does take extraordinary effort to relaunch the system. The shutting it down meant for those who had what's called non-urgent scheduled surgeries, which is what we delayed. It was, in some respects, easy to shut that down. It's easy to say no in a system. Much harder to get going again because we have cases continuing into the system. We have to assess patients for the urgency of the surgery. It's an enormous challenge. And because we have people on a wait list already, and this simply adds to that, and presents a real challenge for the system. But I think we're up to addressing it. We're going to throw everything we have at this issue because I think the people who have made a real sacrifice in seeing their surgeries delayed, those people deserve that. With respect to 24/7, you'll know that in the case of MRIs, for example, we've done that around BC over the last couple of years, moving, I think, from 2 machines going 24/7 to 9 machines going 24/7 to 19 going at least 19/7. Surgeries are a little different. We need human beings. They need They do need to sleep, and so what we're doing and to prepare, and we do have to staff surgeries in a significant way. So what we're doing is the plan is to extend the hours every day for surgeries, and then to look at weekend surgeries so we can increase our capacity. This is how we can increase the number of surgeries we can do, reduce the COVID-19 related increase, and then we hope continue on to reduce wait times once we get through this coming 17 to 24 months.
Our next question is from Justine Hunter.
Hi, thank you. How much of the success of this plan hinges on surgeons and anesthetists and nurses who are willing to expand their hours and give up their summer holidays, work weekends? And what's the backup plan if you don't get that buy-in?
On my way to the legislature today, where we are now, I ran into a surgeon who was biking and who told me about their commitment to get going, how determined they are. These are their patients, and I think it's and I speak of surgeons, I think of nurses, I think of people who keep operating rooms clean, who perform such an important function. They profoundly care about the success of the system. They are determined to deal with this backlog. And so I think we're going to have enormous buy-in from everyone in the system. This is what they do. This is their life's work. And this is the biggest challenge in terms of surgery that we've faced in our healthcare system. And so we need to be all in on it. And I know that our staff, who have been extraordinary, and it has been a challenging time, both for the mental health of people in acute care and across the healthcare system of people who have been on the front lines of COVID-19. But I also know their extraordinary motivation, and I think together we can make enormous progress. And that's what we're going to do, and we're going to report, as I say, monthly on how we're doing.
Next, we have Vaughn Palmer.
Question for the Premier. What's been described to us here sounds like a major transformation in the healthcare system, from operating hours to staffing to training to changes for productivity and everything. There is a funding increase as well. But I guess the question I would have is, can you see that this transformation, which is done to clear the backlog, could become a permanent thing in the healthcare system in British Columbia?
Good question, Vaughn. We have, since 2017, been focusing on trying to increase productivity within the system. Adrian spoke about diagnostic services that were multiplied in our time leading up to the advent of COVID-19. That was a transformative change in determining how many surgeries were required. We were creating more opportunities for those surgeries. And I remember quite vividly when Dr. Henry and Minister Dix and I started talking about the pandemic plan and the consequences to elective surgeries and the impact that would have on individuals. And we resolved then, some months ago, that we needed to have a plan to make sure that we could try and get to the place we'd worked so hard to get to in January, February of 2020. Adrian just touched upon, Vaughn, the commitment of healthcare practitioners, whether they be care aides, whether they be janitorial staff, whether they be nurses, whether they be admissions clerks. All of the people involved in our healthcare system are committed to the well-being of the people that they serve. And we're going to be redoubling our efforts. It's very ambitious, and I think that ambitious can be infectious as well in a positive way. When we see success in our personal lives, we try to duplicate that day after day. And I think the system will want to do that as well. We're asking a great deal from people, but I believe they're prepared to give it. And we will be doing what we can on the resourcing side. Adrian and the Minister of Finance are in regular contact about what this will mean over time. But we're focused right now on getting back to a place where people can have confidence in our healthcare system, which is in many ways the envy of the world. Certainly in North America it is, and we're proud of that. I'm fiercely proud of the work that the ministry has done to get us into this place, and I'm absolutely confident that we're going to be successful.
Our next question is from Moira Whiten.
Hi, Premier. Thank you. My question is a follow-up on Vaughn's question, but, would we potentially see a scale down after the pandemic-related backlog is cleared? I know that's a couple of years away, But earlier in the technical briefing, it was mentioned that this is kind of an expedition of a 5-year surgery plan that was in the works. So is that 5-year, is that a timeline that we would see this sustained, or what is that timeline?
Well, as the technical briefing suggested, this is not something that will be resolved over the course of the summer. It will take time, and we're committed to it. We wouldn't have brought it forward if we didn't believe the system was able to handle the increases and the diversity of solutions. We are outside the box in many ways. Provided we're working within the Canada Health Act, we believe that there is capacity, and if we challenge that capacity to expand and we work on increasing the number of graduates we have in healthcare professions, if we increase the resources available, and that is our commitment, we'll be able to achieve these goals.
Our next question comes from Keith Baldry.
Hi, thanks for this. This is more about reopening than surgeries. Just getting inundated with calls and emails from Albertans wondering, in light of the request to stay home and not travel, are Albertans welcome in British Columbia this summer, Mr. Premier?
Well, certainly Albertans are Canadians. We have mobility rights as Canadians. These are fundamental principles. But I know from talking to Premier Kenney, I know from talking to other premiers across the country, the objective is the same wherever you may live. If you don't need to travel, you should not. You should stay in your own community. We are just now reopening after what has been a difficult and challenging time for British Columbians. Many people in rural and remote communities are concerned that the full effect of COVID-19 has not reached their communities, and they're fearful that it may arrive. That's why we worked, Minister Dix and I and others, to put in place a rural, remote, and Indigenous community strategy so that we have the capacity to bring people to acute care services should they need them. And so my recommendation to Albertans is the same as my recommendation to British Columbians. Stay home, enjoy where you live, do the best you can to work together, as we have been doing, to flatten the curve and ensure that as the summer progresses, we can have more interaction with our neighbours, whether they be Albertans or people from the Maritimes or any other part of Canada. But for now, it would be better if you stayed home.
Next, we have Laura Brom.
Hi, I was just wondering if, you mentioned that some surgeries will continue even if the patient has COVID-19, but in some cases it would be canceled. So if it does get canceled, like the person wakes up, they have a cough, cold, whatever, would they get pushed to the back of the line, or how would it be determined where and when they end up getting their surgery?
Yeah, I think this is a common occurrence all the time, even before COVID-19, that people have to be well for their surgeries. And so this is an important thing. And that's why it's important when you have your surgery scheduled to make sure that you're staying very close to home, that you're not out mixing and mingling if you can help it, because we want to make sure everybody's well enough to have their surgeries as scheduled. But we do have a provincial process for this, so people will be fed back into the queue according to their need, and people will be rescheduled. So it won't be you'll be back at the bottom of the list. It'll be rescheduled as appropriate as part of the whole system. So it is incredibly important, though, that people are careful right now, and we don't want to have any more delays. So that's a really important piece to bring up. And people, be careful before you have your scheduled surgeries. Make sure that we have the screening processes in place so that everybody can be confident and cared for safely.
Next, we have a question from Rob Shaw.
Premier and Mr. Dix, I was just hoping you could reflect on, I'm sure there are some people on that list of 30,000 canceled surgeries who are in pain, and they're wondering if the decision to make the cancellations the way they were made was really worth it, given that British Columbians did step up, they flattened the curve, and we've had a record number of empty beds in hospitals the last couple of months because the surge didn't emerge like the worst-case scenario suggested it could. So I know you both said it was a difficult decision to cancel these surgeries, but can you address people who are wondering if it was the right call to do it in the way that you did, given the space that we've had the last couple of months?
It was absolutely the right call. You'll recall back in March, there was a very different discussion about COVID-19. We saw images every day on television about what had gone on in Italy. We were working in the healthcare system, and what this has allowed us to do in the healthcare system is respond at the acute care level at I think an extraordinary level of skill and care for people who are dealing with COVID-19. And so it was the right decision at the time to ensure that our healthcare system was prepared, that the extraordinary anxiety that that system was facing, seeing what was happening in places such as Italy and then New York in our healthcare system, was we were able to undertake that effort with the calm that Dr. Henry always asked for. And so I think it was absolutely the right decision, that we have to continue to be prudent. And I think it's a good opportunity to remind everybody of the sacrifices that have been made, particularly by those who were scheduled for surgeries and have had their surgeries delayed. Those sacrifices have been profound, and why we continue to have to be 100% all in, even as circumstances change, because our ability to succeed on the surgery plan and so much else of what we're trying to do depends on people's commitment to one another, to the ones that they love and to the ones that they don't know. This has been our success as a province. It was not inevitable. It was the result of extraordinary work by public health officials, I think, in communities. I think we'd all say all the people who worked on contact tracing, all the people who helped break the links of transmission, all of the people that made sacrifices in our community. Was it worth it? You bet it was. You bet it was. Le Premier ministre va ajouter quelque chose, juste pour dire que le 16 mai 2020, nous avons pris la décision difficile d'annuler de nombreuses chirurgies. Nous avons également promis de ne jamais oublier les personnes affectées par cette décision. Vous êtes au centre de ce plan de renouvellement de la chirurgie. Nous le ferons de la manière la plus sûre possible. Nous ferons ce travail avec la même détermination que celle que nous avons faite en combattant COVID-19. Tous les membres de notre système de santé et tous les citoyens de notre province sont attachés à ce plan.
Yeah, I just, going back to Rob's question, absolutely the right thing to do, but we need to put into a context that today is the day after we announced our slow and focused restart plan, and the first order of business is to say to those who made a significant sacrifice by having their surgeries canceled that they're at the top of the priority list for us going forward. This was a very difficult decision to make, the right decision to make, but as we made it, we were mindful that these were not just numbers on spreadsheets. These were human beings. People, in many cases, have been waiting a long, long time, and we are going to focus, and the resolve is fairly clear from the technical briefing, the commitment that we anticipate from healthcare providers, the resources that the Treasury will be providing, so that healthcare, the fundamental principles of healthcare, that tenet of Canadian citizenship that is so important to us, is the first order of business. Absolutely the right decision, and this is absolutely the right response.
Our next question comes from Lisa Cordasco.
Thank you very much. You've been very specific in saying that you need 400 surgical nurses and where you will get them. But in terms of surgeons and anesthetists, how many do you need and where will you get them?
We're confident to do that. I think it's fair to say that over the past decades, sometimes the relationships between health authorities and anesthetists and anesthesiologists have been challenging, but we're making progress with that, and we need to recruit there as well. And so everybody's committed to this. We obviously need to increase our capacity in every area. One of the key areas, though, and has been over the last period, is surgical nurses. That's been a challenge over a period of time, so that's why we give focus to that today. But we're going to require more medical office assistants, more skilled healthcare workers, and obviously surgeons and anesthetists. I think what's been sometimes a restriction in our healthcare system is the amount of operating room time people have, not necessarily the number of surgeons. So this expansion of operating room time is going to help us as well. So it's a combination of that operating room time, of the work of the system to prepare people for surgery so that the outcomes are good. It's going to require significant investment in post-operative care because that's critical to the success of any surgery. So what you're talking about is major investment in people to make this go forward, but it's in all of the areas, including of course, nursing.
Next, we have a question from Cindy Harnett.
Oh, thanks very much. I wanted to clarify, what is the percentage of beds that will be left in COVID-designated hospitals in case there is a surge? Is there a percentage? And can you tell me what the balancing act is between the temptation to do a lot of day surgeries and hips and knee surgeries that can be done quickly, and weighing that against complex surgeries that may include multiple days in hospital and extensive follow-up that would impose on COVID beds if you needed them?
Well, the key question is the urgency of need, and you've seen that during this period. We have successfully completed across health authorities 17,000 surgeries, urgent surgeries and emergent or emergency surgeries in this time. And the priority there are people who required surgeries for things with shorter required wait periods, 2, 4, and 6 weeks. So the people who needed the care urgently got the care urgently, and 17,000 in the context of what's happened with COVID-19 is important. So what you're going to continue to see is the clinicians, is the people who are responsible for doing the surgeries, setting priorities. And that means, in part, doing surgeries that we're able to do, for example, in the private clinics, where we did between 12 and 13,000 surgeries in 2018-19, and increasing that capacity. And all of that surgery is day surgery in that case, because in none of those places are people able to stay overnight. So that's all day surgery on the one hand. But it's prioritizing patients. One of the great successes we've had, and it represented an effort by members of the legislature, extraordinary effort by a skilled surgeon named Dr. Honey in Vancouver, was a surgery called deep brain stimulation, which takes hours and hours and hours and hours. And that's been a priority as well. And so we all know that a 7 or 8 hour surgery counts as one, just as a surgery that only takes an hour. But we've got to balance off those things, and that's our intention too. There's no, in our processes, there's no gaming of the stats. We need to do all kinds of surgeries, day surgeries, of course, but also the more serious surgeries you talk about, and they're already being given urgency in the system. Yeah, sure.
Just to speak a little bit about some of the thinking that we have around what do we do if there's a resurgence and what proportion of beds would be COVID beds, et cetera. So we obviously have considered that, including looking at critical care. So there's some surgeries that people are more likely or will need to be in ICU afterwards. So that has an impact on our ability to provide critical care, both to people with COVID and people with other things. So we are very much looking at that balance and ensuring that in different parts of the province, it may mean transporting somebody for surgery to a different area. And then as we go into the fall in particular, assuming we don't see any resurgence of COVID-19 in the summer, and that's what we'll be focusing on, of course, but in the fall when we start seeing influenza season again, and there's a potential for what we're calling a second wave or a resurgence of COVID-19, then we'll be looking again. As you know, we talked about having 19 COVID hospitals that we had available and ready to go through this period of time. We'll be looking more strategically come the fall, because we do know more about this virus, and we will be ensuring that we have our surveillance and our public health detection out there so that we can respond a little bit more nimbly and also with more precision come the fall. So it may be that some hospitals will, not all 19 hospitals will need to be available right away for COVID-19 surge, and we'll be able to titrate that in a better way. So those are the things, obviously it's very complex, and those are the types of things that we're thinking through as we move forward.
We have time for 2 more questions. The first is from Nomi Mukanda.
Oh, good morning. I'm just going to go through, many of my questions have been asked, but I wanted to know what's going to happen to people from out of province who had been scheduled for specialized surgeries in BC and had them cancelled. Will they be allowed to travel here to undergo the surgery?
Premièrement, ça va dépendre des individus, je pense, et des circonstances, mais on va recommencer notre programme de chirurgie. Mais ça va dépendre, premièrement, d'un individu. Par exemple, il y a beaucoup de monde qui habitent les territoires en Colombie-Britannique, au Canada, qui reçoivent leur service de chirurgie en Colombie-Britannique. Et pour ces gens-là, on va continuer avec nos programmes, avec les limitations et la nécessité de voyager. Donc, ça va être une question entre le système, les médecins et bien entendu, les patients. Donc, ça va dépendre de ces circonstances. Mais ce dont on parle, c'est le recommencement de notre programme de chirurgie élective et ça va inclure tout le monde qui reçoivent ces chirurgies maintenant. Ce n'est pas en général les personnes des autres provinces, c'est surtout des personnes qui habitent au Yukon et au territoire.
And do you want to repeat that in English?
I think.
All right. Our last question comes from Richard Zisman.
For the Premier. One of the things the education system is seeing, both K-12 and post-secondary, is going to be a huge drop-off in international students. And there are already concerns being raised that this drop-off will mean teachers need to be laid off and could potentially need other changes because of the decrease in revenues. How much does this concern you for both levels of schooling? And also, are you considering, unrelated note, salary top-ups for essential workers as we've seen from the federal government?
Well, firstly, with respect to the top-up, this is a cost-shared program. All the provinces have agreed to join with the federal government. Minister James is working with the federal government to put in place the plan for British Columbia. Many of the workers, frontline workers in residential care, for example, where some of the focus of the federal government has been, are already well above what the threshold number would be. So British Columbia will be developing a plan in concert with the federal government that meets the needs of a broader group of employees. But we're grateful to have the federal resources, and we're going to be doing our part to address the need in that area. When it comes to international students, this is at the post-secondary level. As we see people retooling for the new economy, what the world will be like for them going forward, we need to ensure that we have a maximum number of spaces in our post-secondary institutions, whether it be for skills training, whether it be for training to become care aides, to go into some other medical field, or any number of other areas. So we're fairly confident that our post-secondary sector has the capacity to take in those new students who, because of other work that we've done on adult basic education, for example, and English language learning, will be able to meet the needs of the community right here in British Columbia. We also understand the value of foreign students, international students coming to our post-secondary institutions. So we'll be working with the university presidents on how we deploy spaces for that cohort. When it comes to the K-12 system, every district has a different approach to international students, and Minister Fleming and I will have more to say about the K-12 system in the weeks ahead as we look to the wrap-up of this year and prepare for the beginning of the 2021 school year. And international students may well have a key role to play in that, and that will be determined district by district. But we're not contemplating layoffs. Quite the contrary. Education is the key to success for individuals and for communities. It's the great equalizer in our society. We have been committed from the beginning to expand access to education for all British Columbians, and we'll continue to do that.
That's all the time we have today. Thank you.
Great. Thanks.